Let's look at how we go about processing the reception of information and how we perceive visual information within the environment. In order to do this, we have to start off with a little bit of physics here, and we have to review the physics of light. And light is unique. Light will always travel in a straight line until it interacts with a different medium, at which point in time it will refract or it will reflect. Refraction is bending but continuing to move forward. Reflection is bending and heading backwards. And so when we look at light, the way in which the retina is going to receive the visual information is inverted and reciprocated from the light within the actual visual field. Meaning that the superior visual field is actually going to be received on the inferior aspect of the retina, and the inferior aspect of the retina becomes the superior visual field retina. Whereas the inferior side of the visual field will be received on the superior side of the retina, which become the inferior receptor region of the retina. Same thing happens for the right and left. And so what that means is that the way in which our retina is picking up the information, top becomes bottom, right becomes left. And so we flip it and then we flip it. And so what ends up happening is the tree goes from being upright to being received in an inverted and reciprocated position. And our ability to bend the light so as to get this flip to occur and have all of the light strike at the correct spot on the fovea is due to what's referred to as far and near point accommodation. This far and near point accommodation is about how do we change the tension within the suspensory mechanisms to change the curvature of the lens to accommodate where the light is coming from and how the light is either diverging or converging at the point of entry into the eye. Where the far point is the farthest point that I can get this correction to take place, and near point is the closest point that I can get this accommodation to take place. Now, this is what the bending of light should look like in normal conditions, but most people are not normal. Most people have some sort of either anatomical change or suspensory ligament change that has taken place, leading to irregular curvatures. If I happen to have an anterior-posterior displacement of the eye, that means that the eye has become elongated in an anterior-posterior plane. I become myopic. I am focusing light in front of the retina as opposed to focusing light onto the fovea centralis, which means that I have to break apart the light waves in order to get them to rebend correctly onto the eye itself. The other displacement I can have is a superior-inferior displacement. On a superior-inferior displacement, the bending of the light occurs in such a way that the light is bent past the retina. In this case here, I have a hyperoptic eye or a far-sighted eye. And so what I have to do now is I now have to correct that by having the lights bend prior to entry into the eye to allow for it to focus onto the fovea centralis and thereby be able to see clearly. There is another abnormality that can take place anatomically, and that is not on the anatomy of the eye itself, but is on the anatomy of the lens itself. and that is where we get issues with diffraction of light, and the diffraction of light leads to scattering of light across the fovea, and the scattering of light across the fovea leads to issues of vision where it's not person is nearsighted or farsighted, but is a completely different visual abnormality. We will talk about that other visual abnormality when we get together and how that visual abnormality is corrected. So we've had light strike the eye. How do we get that from striking the eye to the occipital lobe so as to understand what is being represented? And this is where we have to look at the physics of light travel and remember our hemispherical lateralization of the cerebral cortex. And so what ends up happening is that light that is coming from the temporal half of, or the lateral half of each visual field is going to be received on the medial or the nasal side of the retina. Whereas information coming from the nasal or medial side of the visual field is going to be received on the temporal or lateral side of the retina. Within the visual pathway, the neurons coming away from the nasilar side will decussate, will cross to the contralateral hemisphere of the cerebral cortex at the optic chiasm. Stemming away from the optic chiasm, we get junction points. We get junction points at the geniculate. We get junction points within the tectal plate. The junction point at the geniculate leads to what's referred to as the formation of the optic radiations. This formation of the optic radiations will reorient the organization of the neurons so that when those neurons hit the primary visual field, primary visual cortex, the orientation of the neurons matches the topographic organization of the external environment. What does that mean? That means that what we have flipped at reception gets reflipped within the optic radiations so that in the visual cortex, right is right, left is left, superior is superior, inferior is inferior. Medial is medial, lateral is lateral. This pathway also sets up two relay spots. The two relay spots are at the colliculus in the tectal plate and at the geniculate of the thalamus. And what these relay networks do is that they set up two distinct reflex pathways. These two distinct reflex pathways connect onto the polar nucleus, which has an organization of neurons that are set up to match distinct shapes. The distinct shapes mirror objects in animals that are of a dangerous nature and link directly onto the amygdala that will trigger autonomic responses when those polar nuclei neurons get excited. Coming off of the colliculus, we get the tectal spinal tract, which is going to allow us to have a visual reflexive behavior. This is where we can respond to things flying at us in the environment at a rate that is faster than we are able to visually process out the information and then respond to that information. Within this pathway, we get an organization within the lateral geniculate nucleus where we have a mapping of the different ganglionic cells that establishes what's referred to as a retinotopic map. This retinotopic map allows for an organization to be passed on to provide for a three-dimensional color representation that provides depth and binocularity to our visual field. The depth and binocularity of the visual field allows us to know where in the visual field distinct things happen to be, and then how those distinct things happen to be changing within the visual field. And it has to deal with the convergence and divergence of information coming away from what's referred to as the simple cells, passing the information onto the visual cortex. In the visual cortex, the retinotopic map continues, and the retinotopic map continues in such a way that within the primary visual cortex, which is referred to as V1, we get an organization of right-left based off of bar, plane, or single angle activation. That single angle activation then gets passed on and processed into a conjunction of visual information within the secondary visual cortex, where we start to develop a black and white, exaggerated or caricatural organization of the visual field, which then gets compressed in the third and fourth visual cortex. As it gets compressed into the third and fourth visual cortex, activations off of the conal cells leads to the processing and understanding of color representation, where as we start to expand out into the fourth, fifth, and sixth visual cortices, we start to develop a full three-dimensional binocular color representation of the external environment. The way in which we are able to understand this environment is based off of how we pass the visual information along. As it heads out from the primary cortices, it has two pathways. It has a parietal pathway and a temporal pathway. This parietal and temporal pathway leads to distinct representations and organizations within the pathway, where on the parietal pathway, we're able to develop a spatial action representation. Whereas on the ventral or temporal pathway, we're able to determine a recognition pathway. The spatial recognition pathway allows me to know where in the environment that thing happens to be. The object recognition pathway allows me to determine what is that thing. Do I recognize that thing? How can I categorize that thing? It's the object recognition pathway that allows us to remember objects in space. It's the visual action pathway that allows us to determine what is our relative orientation in space to that thing, and how can I move around the environment to accommodate for that thing, either to catch that thing, avoid that thing, or interact with that thing.